The seasonal flu season hasn't even officially begun yet, but the CDC says 41 states, including Washington, are already reporting widespread flu activity. In Spokane, doctors' offices are so busy handling flu-related calls and visits that people are now turning to emergency rooms for care. KXLY4's Tori Brunetti is live at Sacred Heart. And Tori, if you go to the ER, you better be prepared to wait.
Yeah, at night, the wait to see a doctor can be up to 3 hours because people are coming in by the dozens with a gamut of flu-like symptoms. And nurses say it seems nobody is really safe. They're seeing adults, teenagers, and kids all concerned about the swine flu. The doors to the emergency room at Sacred Heart are working overtime. Typically, the pediatric ER sees around 50 patients in a 24-hour period. Over the weekend, they saw nearly 90.
It's huge. We're only a 13-bed unit.
Pam Sheldon is the nurse manager in the pediatric ER, and she says she has never seen a flu season like this one.
You go to the CDC website, and it changes on a daily basis. And so I think it's the unknown. We don't know if it's going to mutate or how it looks.
Chantel Fisher made the trip to the emergency room with her 3 daughters this morning. One of them isn't feeling well.
She just started getting sick this morning, and I'm not chancing it. I'm bringing her straight in to find out what it is.
What Chantel didn't expect was to be one of many who had to make the trip.
When I came in, it was overwhelming to see everybody with their masks on and realizing how serious it is.
If you look around the emergency room these days, more people than not are wearing a mask. In some cases, not because they are sick, but because they don't want to get sick.
There are a lot of concerns because it's a new strain.
A new strain of flu with a lot of uncertainties has doctors and nurses preparing for a long flu season.
Doctors' offices are full and busy, and I'll ask the parents, have you seen your primary provider? Can't get an appointment.
Nurses say when it comes to kids and H1N1, the scariest part is that fever. In some cases, it's getting up to 105, and it seems when it comes to kids and this virus, it can last up to a week. Again, doctors say if you don't feel well, if your child doesn't feel well, stay home and wash your hands. In Spokane, Tori Brunetti, KXLY4 HD News.